what's up YouTube? Quick and simple, this is part 2 of an in detail how-to, like step-by-step process of the Stomp 2 medical bag. We've already done, the whole first panel, addressed where things would go if, a person would have certain, pieces of equipment, and how I like to run my gear, and maybe that might help you. I don't know. So let's just see. All right, this is also for TacticalSoleSurvivor, who asked me how to set this bag up, and we're gonna get into it. All right, I got 2 ladder splints that are about like 3/4 of your leg if you're like an average height, 5'8", 5'9" kind of person. And they go one on each side. I put them one on each side because it helps maintain the integrity and shape of the bag, and it helps protect the contents on the inside, because this is where all my advanced airway management, IV therapy, medication, and basic boo crap goes. I got 2 SAM splints still in the wrapper. I used to take them out of the wrapper and fold them and do all this other crap, but the reality of splinting someone is that if you're going to take the time to splint them, you're in a more stable situation than, oh my god, let me control the bleeding and then just get them out of here. Because there's care under fire, care during contact, and then there's care away from contact, and then there's during medevac, and when more prolonged definitive care. This bag is not for definitive care. This bag is so that I can evac somebody and have everything I need to not let them die. Alright, so for starters, we're going to go up here. And up here, I have an airway module that this bag comes with. And I'm going to do a quick little in detail of how I have everything set up. I have tubular to tie down my ET tubes. I have tape to tie down my ET tubes. I have a Ppe syringe with some, I can't remember what kind of tubing this is, but I think it was some kind of O2 or hospital grade suctioning tubing. Ppe syringe, and it makes great for improvised suction because this damn tip is really, tiny. So trying to pull all that crap out, it's like a hand pump vacuum that works. And then it simply secures down into the elastic. Instead of Magil forceps, I have these, which are shorter, and they almost look like barbecue tongs. I can't remember what they're called at the moment, so I'll get that out there later. And I have my Laryngoscope Blades. I got a Mach 3 and a Mach 4. I keep them in the elastic right here. They're separated, but they're still together. Since I don't use my laryngoscope handle a lot, and I don't want the batteries to explode inside it, I keep the batteries out of the handle. I keep all my ET tubes in size order all the way up. And then on this side, I have 2 syringes for my ET tubes. I've got my oral pharyngeal airways. I've got some occlusive dressings. These are IV 3000 dressings, their standard model, and they're great. These things, I wish they sold them in stores, because quite frankly, these are like the Ferrari of occlusive dressings. They're almost as big as a hyphen chest seal. They're just not as thick and have all that nice cloth and stuff. You take one of these, you can use it as a chest dressing, or like say you have to do a cricothorastomy, right? Now you can secure the tube besides tying it down. So you have all these options. I have right in here, I have a pair of gloves, a syringe for my little I think this is 6.5. Yeah, 6.5. This is for if you don't have one of those really fancy cricothyrostomy kits, or cric kits as they're calling them now, take a set of gloves, a 6.0 or a 6.5, iodine swab, and I prefer to have, this is a 15 blade, some guys use 10s, 15 works for me, does what I need it to do. And then, well, you got your syringe and everything you need to do it here without the pain management meds. Usually you want to use something like Versets and Etomidate, and two together work. I've got 14 gauge IV catheters, and I have all my nasal pharyngeal airways, NPAs, and I have my C batteries for my laryngoscope set. Now there's all these elastic and loops in here. I don't use them. That's user preference. I have everything set up just the way I need it. And then once I take everything and tuck it down, secure it with these little Velcro tabs. And it zips neatly shut for me. Sometimes the string on these tabs wears out, so what I did was, like on my little IV area here, on my needles, run through, it works. And what I'll do is, right here, I'll take my end bag. Oh, almost forgot. Lairdales, these are pretty cool. They've been in my bag forever because I don't really get to collar anybody anymore. But they adjust. Wow, these things have been in my bag a really long time. This one's still in the wrapper, so I guess I'll be using this one first. These stay out of the way right in there. My ambu bag fits perfectly in this little spot right here. And then my Petzl headlamp. Do a quick functions check to make sure the batteries work. Because this thing I use at a fairly decent rate, and all I really have to do to maintain, to make sure that the battery didn't break on me, just take these two out and lock them in like that. So when I go to check my equipment to use it, I know that not only it works, but it's not damaged. That falls under the whole it working process. Boom, done, just like that. Make a little bit less space on the table, but you can still see everything I'm doing. And then this is my Pelican case with the little bit of medications I have, and really rigged up. I did this myself. This goes right in here. There's actually like a pull-out module with pick and pluck, carved foam. I don't have it anymore. Anybody kind of acquired the foam for me. You know what it is when you acquire something. It's not yours, but you found it. So, oh well. Then I have my, this is a collapsible poleless litter. This thing is old as dirt. I love it. It still works. I put this at the very bottom of my bag. And just like that. Now this is my Ppe Kit stethoscope. I can put this in right here, or I can just kind of let it ride on top of whatever. Because Ppe cups are awesome. They can be used for a myriad of different things. You could use them as a tourniquet if you can't find a vein. You can use them to do pressure infusion on your IV. If you got a liter bag, you take the Ppe cup and wrap it around and call it a day. What we're going to get into now is my IV module, where I keep my sharps and how I keep my sharps. First thing I'm going to do, this is my Ppe Kit. It's got sterile gloves and sterile drapes and a biohazard bag. My instrument set. This goes in here. Steri strips. I've got 2 Ziploc bags of different Steri strips in one bag. Itoform packing strip for doing incision and drainage where you have to pack a wound to keep it open so you can let it drain. And this is basic iodine swabs, first aid dressings, and stuff like that. I keep it in here also because it makes more sense for me to have it in here. Because if I'm doing a procedure, chances are I need extra gauze or little band-aids or whatever else afterwards. IV tubing. I know it looks like I'm loading this thing down, but trust me, it can take, this bag has taken so much more and then some. And then right now I've got a Venegard dressing, 2 Tegaderms, and my personal favorite Ferrari of IV dressings here, the IV 3000. Smith and Nephew, if you want to, send me some. You know, hey, I love these things, they work. And then I got my little sharp shuttle. North American Rescue has them now. I got them back when they were made by Kendall. Go figure. Before North American Rescue was the thing, I guess. Alright, now I got syringes with hypodermic needles. So what I'm going to do really quick is look at them, make sure they're not damaged, broken, crappy looking, you know, not sterile. I've got them in 23 and 25. The 25 is like sub-Q, like more like intradermal. If you're doing like PPD or the syringe is too big, so I wouldn't do PPD with it. I'd more than likely use it for administering lidocaine for a procedure. And I got 23s because they're just big enough to push a medication if I need to, and they're not that big to cause pain. Got my IV catheters, got 20s, 18s. Bear with me just a second, trying to, I literally emptied, you know, the entire bag so that I could put it back together on video for you. So we're going to start with biggest to smallest. You could fit up to 4 in here, but for storage and, you know, to maintain the quality of the elastic, I don't anymore. Quite frankly, I don't have all that much gear anymore. Normally the way I like to have it set is 16s, 18s, 20s, 22s, and then a couple of 24s here and there. But beggars can't be choosers nowadays, can we? I got a couple 24s. They go in here. My alcohol swabs, they go right in this pocket right here. My tourniquets, I lay them out. Check them over real quick. Once they're all gone over, made sure that they can still do this number, they're good to go. Just like that. Then a little roll of tape for, you know, securing your IV site if you don't have dressings. And then just take the tourniquets and tuck them around. Now with these two 25s, one, two, and then with all these 23s, because I have quite a few of them, what I'm going to do is I'm going to take 2, I'm going to tuck them in here. If I had saline locks, like the little pre-filled saline IMT sets, then I'd put them here, and you know, under it I'd have like a little extension tubing. But since I don't have that, this works just fine. turn it so I can see the difference. I can tell because of the different color. I got green for the 23 and blue for the 25s. And then I've got different size little hypodermic needles here. But they're all good. They're still sterile. These are 18s, 25, 18, 21. So once again, same concept, and they're going to go right under here in this little row of elastic loops here. I'm going to go biggest to smallest again. I'm going to turn the bag so you can see better. Can you see, or do I need to move? How are you doing on time? Alright. 21s and 25s. And Shazam. 550 cord on the pull tab, on the zipper, because the pull tab disintegrated after wear and tear. And for demonstration purposes, you got 3 IVs that can fit long ways, or you can fit 4 standing across. But that's really loading your bag down. If you're not trained on IVs and you don't have IVs or access to IVs, this compartment makes great for extra bandages because it has another draw cord here and three straps. And this, you can have all your definitive, you can have your over-the-counter medicine in here, like your little packets of Motrin and stuff like that. I have IVs, so things are different. Got my blood pressure cuff and stethoscope, and more than likely what I'm going to end up doing is laying it flat on top of there, where it's, allows the bag to close. Once this bag is fully loaded and ready, ready to go, it's almost 50 pounds. This, unless you've got a lot of time carrying gear on your back and rucking up a hill with your vest and everything, I don't suggest this for you. But you can leave it in your car and you can have it ready at a moment's notice. This is for anyone who's been in the military, they know what this is. This is it's a Phoenix Junior. It's an infrared strobe. I just take this and put it right along in here for casualty marking. And just like that, I'm done. As you can see, this thing gets full. Then I have 2 carabiners here, and that's for these drop straps. If I'm ever doing like a search and rescue mission and I can't go in with my bag, I can have it dropped under me. But for now, one stays on here and the other stays on here. You've got your 6 compression straps, your pouch on the side, and your shear pouch on the other side. Put my mag light here and my shears right here, and this extra IV goes in the closet. We're done.